This is not a prediction. It already happened. The changes were signed, enacted, quietly implemented, and in several cases already affecting your bank account, your health insurance premium, and the retirement check you count on to survive. And here is the most disturbing part. Most of the 127 million Americans whose financial lives are about to be restructured by these rule changes have no idea they occurred. They were not announced on primetime television. They were not the subject of a national conversation. Some were buried in a 1,000-page bill signed on the 4th of July when most of America was watching fireworks. Some were implemented through regulatory agencies that most Americans cannot name. Some happened through a quiet failure of Congress to act, which is its own kind of action. Because when Congress fails to extend a protection, that protection disappears on a specific date, regardless of whether anyone noticed. The quiet rule changes have already happened. What has not happened yet are the consequences. And those consequences are coming in 4 waves stacked on top of each other, targeting the same 127 million Americans who are already living with no financial buffer. The working families carrying credit card balances at 22%. The retirees watching Medicare eat their cost of living adjustment. The middle-income households who discovered in January 2026 that their health insurance premium had more than doubled. The 70 million Americans that Social Security will cut by 28% in 2032 if Congress does nothing, which historically Congress does until the last possible moment. Start with what happened on April 9th, 2025. Most Americans were not watching. Congress passed a joint resolution using the Fast-Track Congressional Review Act procedure to overturn the Consumer Financial Protection Bureau's overdraft fee cap. The CFPB had finalized a rule in December 2024 that would have capped overdraft fees at $5 for the largest banks. That rule was supposed to take effect in October 2025. It had been projected to save American consumers $5 billion per year, or approximately $225 per household, that pays overdraft fees annually. That rule is gone, repealed on April 9th, 2025, quietly signed into law as Public Law 1910. The overdraft fees are back at their previous levels, typically around $35 per transaction for every American who spends more than their account balance and relies on their bank to cover the shortfall rather than decline the transaction. At the same time, the CFPB's supervision authority over digital consumer payment applications was also eliminated in the same congressional session. 2 consumer protections have gone within days of each other using a legislative procedure that most Americans have never heard of. The Congressional Review Act allows Congress to overturn any regulation finalized in the last 60 legislative days using a simple majority vote in both chambers. It requires no debate, no public comment period, no waiting. It is the fastest legislative tool available to reverse regulatory decisions, and it was used twice in April 2025 to remove protections that the CFPB had spent years developing and that banks had fought in court for months. The banks won. Consumers lost $5 billion per year in protection, and almost nobody noticed because the story competed for attention with everything else happening in Washington in the spring of 2025. Wave 1 of the quiet rule changes is not dramatic, not an announcement, a silent regulatory reversal that transferred $5 billion per year from the savings of American bank customers back to the fee revenue of the largest financial institutions in the country. Every family that overdrafts their account, even once in 2026, will pay up to $35 for that transaction instead of $5. Every family that does it 3 times will pay over $100, not because their behavior changed, because a rule changed quietly in April. Wave 2 happened on the first day of 2026. If you have health insurance through the Affordable Care Act marketplace, you already know what happened to your premium. If you do not, here's what occurred. The enhanced premium tax credits that had been in place since 2021 under the American Rescue Plan and extended through 2025 by the Inflation Reduction Act expired at midnight on December 31st, 2025. Congress did not extend them. They were allowed to lapse. The Kaiser Family Foundation's analysis documented the impact with precision. Subsidized ACA marketplace enrollees saw their average premium payments increase by 114%, from an average of $888 per year to $1,940 per year. That is over $1,000 of additional out-of-pocket cost per family per year, appearing overnight at the start of enrollment for 2026. A 40-year-old earning $50,000 per year faced approximately $2,000 in additional annual costs for a benchmark silver plan. According to the Urban Institute, an estimated 4.8 million people would drop ACA coverage and become completely uninsured in 2026 as a result of the premium spike. Another 2.5 million would shift to different coverage, and approximately 7.3 million total Americans would lose their ACA marketplace coverage for various reasons connected to the subsidy expiration. Health experts described it as reopening the coverage debate that had been largely resolved by the previous years of expanded subsidies. Those families who chose to keep their coverage are now paying twice as much for the same plan. Those families who could not absorb the premium increase are now uninsured. They are one accident, one diagnosis, one emergency room visit away from a medical bill they cannot pay. And the rule that would have prevented this did not change through a dramatic legislative battle. It expired through congressional inaction. The protection had a built-in sunset clause. Congress let the sun set. And millions of Americans woke up in 2026 paying dramatically more for health coverage or discovering they had none. Wave 3 is the largest in scale and the most slowly developing, which is exactly why most Americans do not yet understand its full magnitude. On July 4th, 2025, while most of the country was celebrating Independence Day, the President signed into law the One Big Beautiful Bill Act, a nearly 1,000-page piece of legislation that restructured federal spending in ways that will take years to fully materialize in American households, but have already begun. The Congressional Budget Office estimated that the legislation will cut federal Medicaid and children's health insurance program spending by $200 billion, eliminating coverage for at least 10.5 million Americans by 2034. It cuts SNAP funding by $186 billion through 2034, affecting an estimated 22.3 million families who will see some or all of their food assistance reduced or eliminated. It imposed Medicaid work requirements on able-bodied adults between 19 and 64, with the effective date moved up from January 2029 to December 31st, 2026. That date is 8 months from now. For every American currently receiving Medicaid who does not meet the work reporting requirement by that date, coverage loss is the consequence. The Medicare impact is less direct, but equally real. The League of Women Voters analysis cited CBO estimates that the OBB will cause a $45 billion cut to Medicare in 2026, rising to $75 billion by 2034. This happens through a mechanism called PAYGO, the Pay-As-You-Go Act of 2010, which requires that any legislation that increases the federal deficit must be offset by corresponding cuts. The One Big Beautiful Bill increases the federal deficit by an estimated $3.4 trillion by 2034. Under PAYGO, that triggers automatic Medicare cuts, not because Congress specifically voted to cut Medicare, but because the arithmetic of the bill's fiscal impact applied mechanically by law generates that cut automatically. Medicaid currently covers nearly 80 million low-income Americans, including children, adults, people with disabilities, and seniors in nursing homes. Hospitals, particularly rural hospitals, depend on Medicaid reimbursements to remain financially viable. The Commonwealth Fund projected that the Medicaid and SNAP cuts in the bill would result in 12.2 million jobs lost nationwide, equivalent to a 0.8 percentage point increase in the U.S. unemployment rate. State GDPs would be $113 billion lower. State and local tax revenues would decrease by $8 billion. The cuts produce a fiscal cascade that extends far beyond the individuals directly losing benefits. But here is the quiet rule dimension that makes Wave 3 specifically dangerous. Most of these cuts do not take their full effect immediately. They phase in. The Medicaid work requirements begin December 31st, 2026. The SNAP state cost-sharing requirements begin later. The immigrant eligibility restrictions begin October 1st, 2026. The reduced retroactive coverage provisions begin December 31st, 2026. Each of these dates is a trigger point when a specific rule changes, and a specific group of Americans discovers their coverage is different than it was the day before. Not through a crisis, through a calendar date, through a quiet rule change that already happened with an implementation timeline that is counting down right now. Wave 4 is the one operating on the longest timeline, but the one with the largest eventual impact. The Congressional Budget Office released its 2026 budget and economic outlook in February 2026. Buried in the projections was a revision that moved one of the most consequential dates in American financial history forward by a full year. The Social Security Old Age and Survivors Insurance Trust Fund is now projected to be depleted in fiscal year 2032, not 2033, as was projected in 2025. Not 2034, as earlier estimates suggested. 2032. 6 years from today, when the OASI Trust Fund reaches zero, current law requires that benefit payments be immediately reduced to match incoming revenue. The CBO projects that reduction at 28%. Someone collecting $2,001 per month in 2032 would see that payment drop to approximately $1,491 under a 28% cut. A typical couple retiring just after the insolvency date would face an $18,400 annual reduction in their Social Security income. According to the Committee for Responsible Federal Budget's August 2025 analysis, 72 million Americans currently collect Social Security, retirement, and survivor benefits. Every single one of them, regardless of age, regardless of income, regardless of how many decades they paid into the system, would face the same percentage reduction at the moment of insolvency under current law. There are no carve-outs. There's no mechanism to protect lower-income beneficiaries. The law says that when the fund is depleted, payable benefits equal incoming revenue. That rule is on track to trigger in 6 years. Meanwhile, the institution responsible for processing and delivering those benefits has been simultaneously weakened by a separate, quiet rule change. The Department of Government Efficiency, working through the Social Security Administration in 2025, cut approximately 7,000 SSA jobs, reducing the workforce from 57,000 to 50,000. The agency closed 6 of its 10 regional offices and began closing field offices that serve beneficiaries who need in-person assistance. Former SSA Commissioner Martin O'Malley testified before Congress in 2024 that the agency was already serving 7 million more beneficiaries with 7,000 fewer staff than in 2015, operating at its lowest staffing level in 25 years. The subsequent cut of an additional 7,000 people from that already depleted workforce magnifies the problem. Christine Lazo, a claims specialist and secretary-treasurer of the American Federation of Government Employees, warned at a press conference that the cutbacks will likely delay payments, cause more errors, and could crash the system within months. The SSA processes $5 trillion in annual benefits for more than 70 million Americans. Its capacity to do so accurately and on time is dependent on the staff and infrastructure that has just been significantly reduced. Now calculate the combined effect across all 4 waves and understand where the 127 million number comes from. 72 million Social Security beneficiaries facing potential insolvency in 2032 and current service degradation from SSA staffing cuts. 20 million or more ACA Marketplace enrollees whose premiums more than doubled on January 1st, 2026, with 4.8 million losing coverage entirely. 80 million Medicaid and CHIP recipients, of whom 10.5 million will lose coverage by 2034, and millions more will face reduced benefits, new paperwork requirements, and work reporting mandates beginning December 31st, 2026. 22 million families facing reduced SNAP benefits. The groups overlap. Some Americans appear in multiple categories. When you account for that overlap and count distinct individuals affected by at least one of these 4 simultaneous rule changes, you arrive at approximately 127 million Americans whose financial safety net has been fundamentally altered by rules that were changed, allowed to expire, or enacted in the last 15 months. Now apply the historical pattern because this specific sequence has precedent, and the precedent tells you exactly what happens when safety net erosion and consumer protection removal coincide with record household debt, elevated interest rates, and a population that is already financially fragile. The first precedent is the late 1970s deregulation wave. Between 1978 and 1982, a combination of regulatory rollback, inflation, and interest rate shock compressed the financial position of American middle-class households dramatically. Real wages fell. Credit costs surged as the Federal Reserve pushed rates to record highs to break inflation. Consumer protections that had been built up over decades were rolled back in the name of deregulation and market efficiency. The result was the 1981 to 1982 recession, which drove unemployment above 10% for the first time since the Great Depression. The households that experienced the sharpest financial deterioration were those that had already been financially marginal before the policy changes began. The removal of protection coincided with the removal of buffer. There was nothing left to absorb the shock. Sound familiar? In April 2026, 2/3 of American workers live paycheck to paycheck. According to PNC Bank's 2025 Financial Wellness Survey, Civic Science documented in January 2026 that 76% of Americans have little to no safety net, with 21% reporting they have 0 funds remaining after monthly expenses. These are not the households that can absorb a 114% increase in health insurance premiums. They are not the households that can absorb a $35 overdraft fee multiple times per month. And they are certainly not the households that could absorb a 28% reduction in their Social Security check without being pushed into poverty. They are already at the margin. The rule changes did not create their vulnerability. They removed the floor underneath it. There's a common misconception that needs to be named and challenged directly. That misconception is that these rule changes primarily affect poor Americans, and that working middle-class households are insulated from their consequences. The data does not support that. The ACA premium expiration hits middle-income households hardest in percentage terms. The Social Security insolvency affects everyone who receives benefits without income-based carve-outs. The CFPB overdraft fee restoration affects any household that occasionally overdrafts its account. which research consistently shows is most common among middle-income households managing variable cash flow, not exclusively the poor. And the SNAP and Medicaid cuts, while concentrated on lower-income households, generate job losses in healthcare and food industries that ripple through every community that depends on those employers for local economic activity. The second misconception is that 2032 is far enough away that there is time to address Social Security before the cut triggers. 2032 is 6 years from April 2026. Social Security reform requires building political consensus, legislative drafting, and implementation lead time. The Social Security reforms that prevented insolvency in the 1980s, the last time the trust fund faced a similar crisis, took years of difficult negotiation and were implemented with a very specific sense of urgency that only materialized when insolvency was genuinely imminent. If the same pattern holds, meaningful reform will not arrive until 2031 at the earliest, leaving a very narrow margin for implementation. Every year that passes without reform is a year of compounding trust fund depletion and a larger eventual adjustment required. The third misconception is that the SSA staffing cuts are a management efficiency improvement that will deliver the same services with fewer people. Former SSA commissioners, both Republican appointed and Democrat appointed, have stated explicitly that this is not possible. The agency was already at a 25-year staffing low before the cuts began. Cutting 12% of its workforce removes capacity that cannot be recovered through efficiency gains. Because the work, processing 70 million monthly payments, adjudicating disability claims, verifying eligibility, updating records, is inherently labor-intensive and cannot be automated away on any short-term timeline. Here is what you can do with this information stated directly and without vagueness. On the overdraft reality, if you use overdraft coverage regularly as a cash flow management tool, you're now paying up to $35 per instance rather than $5. That behavioral cost is already in effect. The immediate action is to shift to a banking relationship that does not charge overdraft fees, or to use a cash cushion strategy that prevents overdrafts altogether. There are banks and credit unions currently offering zero overdraft products. Moving your account is one of the few direct responses to a consumer protection reversal that is within individual control. On the health insurance premium surge, if you are paying ACA marketplace premiums that more than doubled and you have not taken any action, explore whether Medicaid eligibility applies given the premium changes and your income. Medicaid expansion, states offer coverage for households up to 138% of the federal poverty level with zero premium. If your income dropped due to premium shock, your eligibility may have changed. Also, verify whether employer-sponsored coverage through a current or new employer is available, since employer plans were not affected by the premium tax credit expiration and may represent better value at current price levels. The implementation date of December 31st, 2026 for Medicaid work requirements is a hard deadline. If you or a household member receives Medicaid and is in the relevant age category, understanding what documentation the work requirement demands and preparing that documentation before the deadline is essential. States will have varied implementation systems, but the federal mandate is clear, and the consequence of noncompliance is coverage loss with no grace period. On Social Security insolvency, the most powerful action you can take is political engagement with your congressional representatives on Social Security reform. The insolvency is a legislative problem with a legislative solution that requires political will to implement. Every congressional action that expands Social Security benefits without a corresponding funding mechanism moves the insolvency date forward. Every year Congress fails to act on reform moves the eventual cut larger. Meanwhile, the SSA's capacity to administer the program has been reduced by 12% in workforce and significantly in physical office infrastructure. Processing times for disability applications, which were already among the worst in the agency's history before the cuts, are expected to worsen. Beneficiaries who need to appeal a decision, correct an error, or establish new eligibility will face longer waits, more difficult access to in-person assistance, and a higher probability of processing errors in a system that is now operating with substantially fewer staff than it had even 12 months ago. The compounding nature of 4 simultaneous waves of protection removal hitting a financially fragile population means that the households that build even partial buffers before the worst impacts materialize will be in significantly better positions than those who do not. A 3-month emergency fund does not solve a Social Security cut, but it provides the time and space to adapt rather than simply absorb the shock. An extra $50 per month redirected from discretionary spending towards savings is not a dramatic solution. Over 36 months, it is $11,800. That is the difference between having options and having none when a rule change lands. The 127 million Americans who will wake up broke are not all waking up broke tomorrow. Some already have, some will in October when Medicaid eligibility restrictions begin. Some in December when work requirements kick in, some in 2032 when Social Security checks are automatically cut by 28%. The timeline is distributed, the impact is certain, and the quiet rule changes that set this in motion are already signed, enacted, and in most cases already taking effect. The pattern is as old as recorded economic history. Consumer protections are established in response to specific crises. Over time, those protections are characterized as burdensome, inefficient, or unnecessary. They are quietly eroded through regulatory reversal, legislative expiration, and administrative underfunding. The households that relied on those protections do not immediately realize they are gone. They discover it at the moment of need, when the overdraft fee hits at $35 instead of $5, when the insurance premium arrives at twice last year's rate, when the Medicaid letter arrives saying coverage has ended, when the Social Security check is 28% smaller than the month before. That is the quiet rule. The change happens silently. The consequence is loud. Take action now. Comment, like, and subscribe if you found this analysis useful or have insights to share.